Nasal packing is a procedure used to control nosebleeds or epistaxis by applying material to the bleeding site to create pressure and help stop the bleeding. Before starting the procedure, it's important to prepare all necessary stuffs we need, like nasal packing material, that can be gauze or tampon, forceps, medications, scissors, and extra gauzes. Cut the sterile gauze to the appropriate size with scissors. The gauze should be soaked with topical tranexamic acid and phenylephrine. These two medications are usually used for controlled bleeding. It is better to use your hand to soak the sterile gauze with the ointment so that all the gauze is completely soaked with the medicine. Tranexamic acid is an antifibrinolytic agent, which means it helps to prevent the breakdown of blood clots. Tranexamic acid works by inhibiting the activity of plasmin. That's an enzyme that breaks down fibrin that is a component of blood clots. By reducing fibrinolysis, tranexamic acid helps stabilize blood clots and promote hemostasis. Phenylephrine is a vasoconstrictor, means it causes blood vessels to constrict or narrow. When applied to the nasal mucosa, phenylephrine constricts the blood vessels in the area. This vasoconstrictive effect helps reduce blood flow to the nasal tissues, which can be beneficial in controlling bleeding. Identify the source of bleeding and assess the nasal cavity for any abnormalities. The use of antibiotic ointment in nasal packing is typically considered in specific situations where there is a concern about infection or to aid in the healing process. If there are signs of infection in the nasal cavity, or if the patient is at an increased risk of infection, such as in the case of nasal trauma or surgery, antibiotic ointment may be recommended. Nasal packing forceps are specifically designed for this purpose. They typically have a long, slender design to facilitate reaching the back of the nasal cavity. However, the specific type of forceps may vary depending on the situation.